Internists occupy a unique role in healthcare. They are experts in a spectrum of diseases and complex illness, earning the moniker, the doctor's doctor. Internists use their vast knowledge, experience, and skill to identify the best possible treatment strategies, making them scientific puzzle solvers. They are proponents of extensive clinical research, evidence-based medicine, and continuing education, fueled by the commitment to provide high-value patient care that balances science and compassion. In 2023, the Philippine College of Physicians celebrates 70 years of excellence and service above gain. Driven by passion, constancy of purpose, and prudence in internal medicine. Take part in the 53rd Annual Congress of the Philippine College of Physicians on May 7 to 10, 2023 at the Philippine International Convention Center. Together, let's revisit all that we've become and move toward all that we can be. The Philippine College of Physicians is unstoppable in plying the road to 70, taking you closer to its 53rd Annual Congress, month after month, on the third leg of its pre-convention series of activities. The PCP invites you to take part in the Universal Healthcare Summit, Understanding Strategies, Aligning Perspectives, on March 25, 2023. The country's finest internists are called to join forces in driving the importance of universal healthcare by gaining more knowledge and insights on its implications in the practice of internal medicine, real-world experience in the local setting, the internist role as a UHC healthcare provider, financial structures and obligations of various Philippine government groups, and the challenges behind UHC. The road to 70 is just around the corner. Be there for the Universal Healthcare Summit to advance your understanding of strategies and align with current perspectives. See you on March 25, 2023. The Philippine College of Physicians is unstoppable in plying the road to 70, taking you closer to its 53rd Annual Congress, month after month, on the third leg of its pre-convention series of activities. The PCP invites you to take part in the Universal Healthcare Summit, Understanding Strategies, Aligning Perspectives, on March 25, 2023. The country's finest internists are called to join forces in driving the importance of universal healthcare by gaining more knowledge and insights on its implications in the practice of internal medicine, real-world experience in the local setting, the internist role as a UHC healthcare provider, financial structures and obligations of various Philippine government groups, and the challenges behind UHC. The road to 70 is just around the corner. Be there for the Universal Healthcare Summit to advance your understanding of strategies and align with current perspectives. See you on March 25, 2023. Internists occupy a unique role in healthcare. They are experts in a spectrum of diseases and complex illness, earning the moniker, the doctor's doctor. Internists use their vast knowledge, experience, and skill to identify the best possible treatment strategies, making them scientific puzzle solvers. They are proponents of extensive clinical research, evidence-based medicine, and continuing education, fueled by the commitment to provide high-value patient care that balances science and compassion. In 2023, the Philippine College of Physicians celebrates 70 years of excellence and service above game. Driven by passion, constancy of purpose, and prudence in internal medicine. Take part in the 53rd Annual Congress of the Philippine College of Physicians on May 7 to 10, 2023 at the Philippine International Convention Center. Together, let's revisit all that we've become and move toward all that we can be. The Philippine College of Physicians is unstoppable in plying the road to 70, taking you closer to its 53rd Annual Congress, month after month. On the third leg of its pre-convention series of activities, the PCP invites you to take part in the Universal Healthcare Summit, Understanding Strategies, Aligning Perspectives, on March 25, 2023. The country's finest internists are called to join forces in driving the importance of universal healthcare by gaining more knowledge and insights on its implications in the practice of internal medicine, real-world experience in the local setting, the internist role as a UHC healthcare provider, financial structures and obligations of various Philippine government groups, and the challenges behind UHC. The road to 70 is just around the corner. Be there for the Universal Healthcare Summit to advance your understanding of strategies and align with current perspectives. See you on March 25, 2023. Internists occupy a unique role in healthcare. They are experts in a spectrum of diseases and complex illness, earning the moniker, the doctor's doctor. Internists use their vast knowledge, experience, and skill to identify the best possible treatment strategies, making them scientific puzzle solvers. They are proponents of extensive clinical research, evidence-based medicine, and continuing education, fueled by the commitment to provide high-value patient care that balances science and compassion. In 2023, the Philippine College of Physicians celebrates 70 years of excellence and service above game. Driven by passion, constancy of purpose, and prudence in internal medicine. Take part in the 53rd Annual Congress of the Philippine College of Physicians on May 7 to 10, 2023 at the Philippine International Convention Center. Together, let's revisit all that we've become and move toward all that we can be. The Philippine College of Physicians is unstoppable in plying the road to 70, taking you closer to its 53rd Annual Congress, month after month. On the third leg of its pre-convention series of activities, the PCP invites you to take part in the Universal Healthcare Summit, Understanding Strategies, Aligning Perspectives, on March 25, 2023. The country's finest internists are called to join forces in driving the importance of universal healthcare by gaining more knowledge and insights on its implications in the practice of internal medicine, real-world experience in the local setting, the internist role as a UHC healthcare provider, financial structures and obligations of various Philippine government groups, and the challenges behind UHC. The road to 70 is just around the corner. Be there for the Universal Healthcare Summit to advance your understanding of strategies and align with current perspectives. See you on March 25, 2023. The Philippine College of Physicians is unstoppable in plying the road to 70, taking you closer to its 53rd Annual Congress, month after month. On the third leg of its pre-convention series of activities, the PCP invites you to take part in the Universal Healthcare Summit, Understanding Strategies, Aligning Perspectives, on March 25, 2023. The country's finest internists are called to join forces in driving the importance of universal healthcare by gaining more knowledge and insights on its implications in the practice of internal medicine, real-world experience in the local setting, the internist role as a UHC healthcare provider, financial structures and obligations of various Philippine government groups, and the challenges behind UHC. The road to 70 is just around the corner. Be there for the Universal Healthcare Summit to advance your understanding of strategies and align with current perspectives. See you on March 25, 2023. Internists occupy a unique role in healthcare. They are experts in a spectrum of diseases and complex illness, earning the moniker, the doctor's doctor. Internists use their vast knowledge, experience, and skill to identify the best possible treatment strategies, making them scientific puzzle solvers. They are proponents of extensive clinical research, evidence-based medicine, and continuing education, fueled by the commitment to provide high-value patient care that balances science and compassion. In 2023, the Philippine College of Physicians celebrates 70 years of excellence and service above game, driven by passion, constancy of purpose, and prudence in internal medicine. Take part in the 53rd Annual Congress of the Philippine College of Physicians on May 7 to 10, 2023 at the Philippine International Convention Center. Together, let's revisit all that we've become and move toward all that we can be.
Let us put ourselves in the holy presence of our Lord. Our dearest Heavenly Father, thank you for making all things possible. We are grateful for all the blessings you are pouring upon each one of us, despite the challenges we are all currently facing. Thank you for blessing us today with the wonderful opportunity to meet virtually and learn together in the awesomely exciting webinar. May your blessings of wisdom and guidance be upon us, all through the sharing and impartation of knowledge and skills by our resource speakers, facilitators, and moderators. May all of us learn together, upgrade our competencies, and capacitate us to be the help in the development of our learners' lives and communities in the spirit of your love and generosity. May we now humbly commit every part of this webinar to you as we all bring you the glory, honor, and praises for your kingdom and holy name's sake. All this we pray in the precious name of our Lord and Savior Jesus Christ. Amen.
Through the dreadful darkness, we shall lead the light and lead a path to wisdom. Our will to be our light. To those in pain and suffering, we shall hear a call. With arms to care and comfort, compassion above all.
The Philippine College of Physicians, through the Committee on Media Communication and Health Forum, presents its bi-monthly lay forum to promote the advocacies and mission of the college and its component and affiliate societies. An avenue of accurate and up-to-date conversations with the media and the general public, with timely and diverse topics covering vital public health and medical information, straight from the experts. In a platform that is convenient, accessible, and highly engaging. Welcome to the PCP Health Forum.
Welcome to another health forum of the Philippine College of Physicians. I'm Dr. Francis Gail Torralba, member of the Media Communications Committee. I will be your moderator for this health forum. Maraming salamat po sa lahat ng regular viewers, sa continuous support mula sa aming media partners at sa mga masugid na taga-subaybay ng PCP sa social media. So our health forum this morning is supporting the Philippine Digestive Health Week for the Colon Cancer Awareness Month. The goal is to empower Filipinos to take care of their digestive health, giving emphasis on screening for colorectal cancer. Before we start, let us hear a welcome message from the current president of the Philippine College of Physicians, Professor Diana A. Payawal. Dr. Payawal is Professor 2 at the Fatima University Medical Center. She is also the chair of the Department of Internal Medicine at Fatima University Medical Center and the chair of the Hepatology Committee, Section of Gastroenterology at the Cardinal Santos Medical Center. She also studied at the Harvard Medical School Postgraduate Medical Education, Harvard Medical School Leadership Scholarship Program with recognition of Excellence Change Movement. And she was also the past president of the Asia Pacific Study of the Liver, Philippine Society of Gastroenterology, and Hepatology Society of the Philippines. Let us all welcome Professor Diana A. Payawal. Good morning.
Hi, good morning. Nais kong batiin ang lahat na naririto. Can you hear me well?
Yes.
Okay, nais kong batiin ang lahat na naririto para sa Philippine College of Physicians Health Forum sa pagdiriwang ng 43rd Philippine Digestive Health Week 2023. Idineklara ni dating Pangulong Rodrigo Duterte ang ikalawang linggo ng Marso bilang Philippine Digestive Health Week na idinidiin ang pangangalusugan at itaas ang kaalaman sa mga sakit at kondisyon na may kaugnayan sa digestive health. Inatasan nito ang Department of Health na manguna at mag-coordinate at mga siwa sa taunang pagdiriwang ng Philippine Digestive Health Week. So kami po sa Philippine College of Physicians ay nakikiisa sa Department of Health at sa Philippine Society of Gastroenterology, Philippine Society of Digestive Endoscopy, and Hepatology Society of the Philippines sa pag-celebrate na itong linggong ito. May pangangailangan na isulong na ang kamalayan, turuan ng publiko at pagsamasamahin ang mga nangangasiwa at na pamahalaan ng bawat iba't ibang sakit at kondisyon na may kaugnayan sa kalusugan. Ako po ay nagpapasalamat kay Dr. Ian Humurkua na nangunguna sa pagdiriwang na ito at sa mga kilalang tagapagsalita niya ngayon na sina Dr. Patricia Ann Cabral Prodigalidad at Dr. Luther Maralit para sa mga maikling lektura na inahahanda at inihanda nila para sa kabuuang Colon Cancer Week Awareness Program. Again, welcome everyone to our health forum for the Philippine Digestive Health Week and Colon Cancer Awareness. Have fun learning, and I'm here as the president of the Philippine College of Physicians on behalf of the Board of Regents to welcome everybody for this morning symposium. Thank you.
Maraming salamat po, Dr. Payawal, for the welcome message to us all. So to introduce the Philippine Digestive Health Week, we invited the Vice President of the Philippine Society of Digestive Endoscopy. She is also a clinical associate professor at the University of the Philippines, Philippine General Hospital, and she is also the head of the Advanced Endoscopy Service of the Institute of Digestive and Liver Diseases at the St. Luke's Medical Center, Global City. Let us all welcome Dr. Patricia Ann Cabral Prodigalidad. Good morning, Dr.
Good morning. Maraming salamat, Dr. Payawal, also Dr. Turalba for the kind introduction. Nagpapasalamat kami sa PCP for the invitation na makasali kami dito sa PCP Health Forum para maihatid namin sa inyo yung aming mga proyekto at saka makapagturo rin tungkol sa colon cancer awareness, which is very important sa ating lahat. No? So I will just share screen. Have I shared my screen? Dr. Turalba, you see the screen?
Yes, we see it.
Recording in
You see it
progress.
very well. Okay. Maraming salamat ulit. So good afternoon sa inyo lahat. I have the pleasure of introducing you all to the Philippine Digestive Health Week. This is our third year to officially be celebrating the PDHW. So ang Philippine Society of Gastroenterology, ang Philippine Society of Digestive Endoscopy at ang Hepatology Society of the Philippines have been celebrating the PDHW through health advocacy programs and conducting their joint annual conventions on the second week of March of every year. So March also happens to be or coincide with Colon Cancer Awareness Week, which is not only celebrated in the Philippines, but everywhere else around the world. This is a special week for the TRICE Society, which was made official in 2020 by then President Rodrigo Duterte when he signed Proclamation number 930.
I think your slides are not moving, Dr.
My slide.
Ayan.
There, did you get it?
Yes.
Okay. So diseases and complications of the GI tract are among the top causes of diseases in the country. And this is supported in a report published by the Philippine Statistics Authority in 2021. So the most common disease conditions, among others, are liver cancer, colorectal cancer, sa tiyan, it's peptic ulcer disease, may stomach cancer then or stomach ulcers and diarrhea. So it is famously known that prevention is better than cure. So how do we do this? We do this by conducting screening programs. We give public education materials and lectures. We support advocacies and awareness programs. So again, the PSG, the PSD, and the HSP have long been joining forces in the fight to combat digestive disease morbidities and mortalities. The three societies have been conducting public education and awareness programs for over 15 years now. And realizing the success through these endeavors on a larger scale is only really possible with the support of the national government. So the societies did not hesitate to approach President Rodrigo Duterte, who responded positively to the call to action. Why is it not moving? Okay, so on March 18, I think it's working. On March 18, 2020, Proclamation 930 was signed by President Duterte, declaring every second week of March as PDHW. In this same proclamation, as Dr. Payawal had mentioned earlier, the DOH was tasked to lead, coordinate, and supervise the nationwide yearly observance of PDHW. So this is actually spearheaded by the DOH. In this same proclamation, right, all national government agencies, government-owned and controlled corporations, universities, colleges, local government units, but also the private sector with civil society groups and professional organizations, they were all also requested to participate and support the DOH in this program. So the main objective of this is to increase awareness and educate the public in the prevention and management of various disease conditions relating to digestive health. with priority diseases being colon cancer, liver cancer, peptic ulcer disease, diarrhea, and stomach cancer. So the PDHW 2023, which is themed Malusog na Tiyan, Masiglang Katawan, Empowering Filipinos to Care for Their Digestive Health, will run from March 5 to 11, 2023. We have a number of activities to cater to medical practitioners and laypersons alike. So the entire week's activities will also be done in partnership with a number of medical and non-medical societies. To name, number one, the Philippine College of Physicians, and we are very grateful for all the help and support and this opportunity also to be presenting to you today. We are also being supported and are in partnership with the Philippine Medical Association, the Philippine Academy of Family Physicians, the Philippine College of Occupational Medicine, the Asian Pan-Pacific Pediatric Gastroenterology, Hepatology, and Nutrition Society, the Philippine Society of Pediatric Gastroenterology, Hepatology, and Nutrition, the Philippine Society of Medical Oncology, Philippine Society of Geriatrics and Gerontology, the Philippine Association of Hepatopancreatobiliary Surgeons, the Philippine Society of Enteral and Parenteral Nutrition, or PhilSpan, some non-medical, some lay societies, but still medical, the Inflammatory Bowel Disease Club of the Philippines, the Cancer Coalition Philippines, the Philippine Alliance of Patients Organization, and the Pharmaceutical and Healthcare Association of the Philippines. So you'll see that we have a lot of activities. The PDHW has kicked off on March 5, that was last Sunday, and it was launched at the Lucky Chinatown Atrium, which was followed by Tummy Talks. So Tummy Talks is a series of lectures given for the lay audience, and this year it featured expert discussions on leading GI diseases, and this was followed, in fact, by a free consultation for early registrants to the event. We also have the PDHW Primary Care Series, which is a lecture series on common GI disorders aimed at primary healthcare professionals, general medical practitioners, nurses, and allied health professionals. This lecture series will be running from March 7 to 10. The PDHW Health Forum was held yesterday. This was via Zoom, and this was for all health professionals, yesterday, March 6. Today, the PCP Health Forum, which we are participating in today, tackles the topic of colon cancer, and we have an expert lecturer, Dr. Ruther Maralit. And this is for not only the PDHW, but also in celebration of March as Colon Cancer Awareness Month. From March 8 to 11, the joint annual convention of the PSG, the PSD, and the HSP is going to be taking place at the Conrad Hotel. This activity, while primarily for gastroenterologists, is open for all health professionals. So topics are going to be on relevant and important diseases and diagnostic and treatment strategies. And this is a very highly anticipated CME activity where both local and foreign experts will be providing participants with very informative, highly informative, and up-to-date lectures. On the last day of the week, on the 11th as well, the topic for the PCP sa Radio Veritas, I Am Informed, will be on Malusog na Tiyan, Masiglang Katawan, with our speakers none other than our President, Dr. Diana Payawal, and Dr. Ian Kua. So there you have it, the PDHW 2023. And before I end, I would like to thank, on behalf of the PSDE, the HSP, our mother society, the PSG, we would like to thank the DOH for spearheading this week-long activity, and of course the PCP and all other medical and non-medical societies for the active participation and support for this worthwhile activity. We invite you all to join us, participate, and be one with us in diminishing the burden of digestive disease in the country. Thank you very much.
Maraming salamat, Dr. Prodigalidad, sa magandang pagpapakilala sa Philippine Digestive Health Week. Marami po palang activities na pwede salihan ng ating mga viewers. So maraming salamat po sa pag-share ng awareness at advocacies po sa ating mga manonood sa collaboration ng societies po at ang government sector. So tandaan po natin, malusog na tiyan, masiglang katawan, abangan po ang mga susunod na pwede niyo pong panoorin po, no, sa pag-introduce po ni Dr. Prodigalidad. Thank you, Dr.
Thank you. Thank
So
you.
to educate us more, we have invited an expert speaker who will update us on what we need to know about colorectal cancer screening. So it is an honor to introduce our speaker. Siya po ay isang clinical associate professor sa Division of Gastroenterology sa Department of Medicine at the University of the Philippines, Philippine General Hospital. Training officer din po sa Division of Gastroenterology, Department of Medicine, UPPGH. He's also the secretary of the Philippine Society of Digestive Endoscopy and a member of the training committee of the Department of Medicine, UPPGH. Let us all welcome our speaker, Dr. Ruther Maralit. Good morning po, Doc.
Dr. Gail, good morning. Thank you for inviting me to give this talk. I would like to thank also Dr. Diana for giving us the opportunity to share our knowledge and hopefully educate everyone on colorectal cancer screening. Let me just share my slides. Can you see it?
Yes, we can see it clearly.
Okay. So again, Ma'am Gail, thank you. So good day, everyone. And first and foremost, thank you, PCP, for this. And you know that Philippine Digestive Health Week was just introduced to most of you by Dr. Sandy, our distinguished gastroenterologist, also from St. Luke's Global and PGH. So this morning, I am tasked to discuss colorectal cancer screening. So I have no disclosures in making this lecture. So colorectal cancer screening, colorectal cancer is the third most common cancer worldwide. And in the Philippines po, it is the third most commonly diagnosed cancer in both men and women. According to the Philippine Cancer Society, there were 8,558 diagnoses of colon cancer in 2020, which resulted to 5,110 deaths. So medyo mataas po yung mortality because of delayed diagnosis. So these numbers highlight the importance of raising awareness about the disease and the need for early detection. Early detection because this disease is actually preventable through screening. So as general physicians and internists, we play a critical role in encouraging our patients to undergo colorectal cancer screening. In this lecture, we will discuss the following. First, colorectal cancer and its risk factors. Second, colorectal cancer screening methods and guidelines. And lastly, the importance of patient education and engagement. So let's talk about colorectal cancer first and its risk factors. So colorectal cancer develops in the colon or rectum and usually begins as a small polyp or contil. So not all polyps are dangerous. Most of them are harmless. However, some can turn into cancer over time. And the exact cause of colorectal cancer is still not known. So we have to identify the risk factors in order to be able to avoid colon cancer. So there are several risk factors that have been identified, and these include actually age. The risk of developing colorectal cancer increases with age, and most cases of cancer in the colon is actually diagnosed over the age of 50 years old. So 50 is the magic number. So the next risk factor is family history. As you can see, genetics plays an important role in the development of colon cancer. People with a family history of colorectal cancer are at a higher risk of developing this disease, especially those with family relatives who have first degree who had colon cancer. So those with first degree relatives are at a higher risk of developing this disease. Another risk factor is inherited genetic conditions. So certain inherited conditions like the Lynch syndrome or the familial adenomatous polyposis increase the risk of colon cancer. Third is a lifestyle risk factor. So full lifestyle choices like tobacco and alcohol are very well known to increase the risk of colon cancer. So we advise our patients to stop smoking and if possible, minimize alcohol intake. Another lifestyle risk factor would include unhealthy diet, such as diet high in red meat and or processed food. Males, unfortunately, have a higher tendency to develop colon cancer compared to women. But in terms of incidence, they are very close to each other. So other lifestyle risk factors would be obesity and sedentary lifestyle. So these two can increase the risk of colon cancer. That's why we encourage our patients to lose weight and to have a more active lifestyle. It is important for us physicians to discuss these risk factors for our patients because some of them are still reversible and we can improve it and decrease the risk of colon cancer. So we encourage them to make these lifestyle changes to reduce the risk and actually to avoid having to develop the disease in the first place. So what are the symptoms of colon cancer? May sintomas mo pa ang colon cancer. So unfortunately, before it becomes cancer, wala. So there are no symptoms before it becomes cancer. So that is how silent this disease may be. But there are suspicious symptoms. However, when you develop the suspicious symptoms, delikado na po, we are considering colon cancer already. So what are the suspicious symptoms? The first one is unintended weight loss. Remember the word unintended. Hindi po nagpapapayat yung patient, pero pumapayat. Second is blood in the stool or dugo sa dumi. So when you see that, it's an alarm symptom. Another one is an alternating diarrhea and constipation. So today, tomorrow, nagda-diarrhea, then the next few days, tinitibi naman po siya. So that's alternating diarrhea, constipation. Another one is changes in bowel habits. Dati po, everyday ka dumudumi. Now, becoming 3, every 4, or every 5 days. And lastly, is the decrease in stool caliber. Ibig sabihin po, paliit ng paliit yung dumi, hindi na bumalik sa normal. So remember these suspicious symptoms, and any of your patients have suspicious symptoms, refer them to a gastroenterologist. So what are the screening tests for colon cancer? It is important to prioritize screening because colorectal cancer is actually preventable. So screening can help colorectal cancer detection early and allow us to treat the patient early if the patient already develops colon cancer. So we have stool-based tests. And the standard now for stool-based tests is the FIT. O ito po yung fecal immunochemical test compared to your FOBT. What's the difference between FIT and FOBT? FOBT po is GAIAC-based. Ito po yung kailangan 3 days na walang wine, walang red meat, iwas po sa dark-colored food because it's GAIAC-based. FIT, on the other hand, is a stool DNA testing. So it is more accurate because it tests for the human globin kit. No? So it can even be done at home. And how often do we need to do FIT? So if FIT is available, choose FIT over FOBT. How often do we do this stool-based test? Annually po, as long as it is negative. The next test is an endoscopic procedure called flexible sigmoidoscopy. So what's flexible sigmoidoscopy? It uses a flexible scope or a camera to examine the rectum and the sigmoid. So only the left side is examined, hindi po yung buong colon. So if this is the one that is done, every 5 years po ang advice for us to do screening. The third one is what we call a radiologic procedure. It is called virtual colonoscopy, also known as CT colonography. This screening method uses X-rays and computer software to create a detailed image of the colon. However, this is purely diagnostic, meaning inaalam mo lang yung sakit kung meron. So if you're suspect na meron pong polyp, you still need to do a colonoscopy. Okay? So when you see a polyp in the CT colonography, colonoscopy is still warranted. And lastly, the gold standard on colorectal cancer screening is actually colonoscopy. It involves the examination of the entire colon or large intestine or malaking bituka. So that the camera is inserted all the way to the right side. And if polyps or other abnormalities are detected, they can be removed during the colonoscopy. So that's the beauty of a colonoscopy because you can actually treat the disease before it becomes cancer. This procedure is repeated every 5 to 10 years if no abnormalities are detected. So it is crucial to encourage our patients to undergo screening tests because, again, colorectal cancer is actually preventable. So when do we start screening? Or do we start now? Okay. The screening age in the Philippines, according to the Philippine Society of Gastroenterology, is 50 years old for average risk patients. Which, anong ibig sabihin ng average risk? Ito yung mga pasyenteng wala naman pong first degree relatives na may colon cancer o walang colon cancer sa family. So we are considered average risk if wala po tayo nun. So we start at the age of 50. However, in the States po, they are now starting to do it at 45 years old. However, hindi nga po natin nagagawa sa Pilipinas ng 50, pipilit pa natin yung 45. So I guess 50 is a good number to start. It is important to discuss with your patient which screening method is right for them and how often should it be done. Okay? So the next one is continuing with the importance of patient education and engagement. Studies have shown that colorectal cancer screening rates in the Philippines is still very low. Mahina po ang uptake ng mga tao, particularly among the low-income individuals, those living in rural areas, and those with low education levels. As physicians, we play a critical role in educating our patients about the importance of screening and addressing any misconceptions or concerns that they may have. So let's increase awareness, especially now as March is Colorectal Cancer Awareness Month. So this is the perfect opportunity to encourage your patients to get screened. So one common concern among patients is the fear of discomfort or embarrassment during screening. As a healthcare professional, it is our responsibility to explain the screening process and assure our patients that any discomfort will be minimized as much as possible. We can also emphasize the potential life-saving benefits of screening and provide educational materials to help our patients make informed decisions about their health. Another important aspect of engagement is follow-up care. So if a patient screening test comes positive, it's crucial to follow up with them and ensure that they receive timely and appropriate treatment. This can help improve their chances of survival and reduce the risk of cancer recurrence. In conclusion, colorectal cancer is a common and deadly disease in the Philippines, but early detection through screening can significantly improve outcomes as the disease becomes preventable, treatable, and beatable. As general physicians and internists, we have a vital role to play in promoting colorectal cancer screening and educating our patients in the country. So by engaging with our patients and addressing their concerns, we can help improve screening rates and ultimately save lives. Thank you for your attention. And again, I would like to thank PCP, the Department of Health, the Philippine Society of Gastroenterology, the Philippine Society of Digestive Endoscopy, and the Hepatology Society of the Philippines for this opportunity. God bless you all.
Yan, maraming salamat po, Dr. Ruther Maralit, for your very engaging and informative lecture. Marami po, Doc, interesado po sa lecture na ito, no? We have a different set of viewers po. We have from the media, and we also have lay persons, and we also have doctors din po, no? Meron pong iba't ibang tanong, pero isa-isayin ko po muna, Doc, ha?
Sige po.
Si Dr. Maralit po, doctor po ito ng aking grandfather, no? Magna 94 years old na po ang aking lolo. So ito po, Doc, may nabanggit po kayo tungkol sa family history of colon cancer. Kung may family member daw po na nagka-colon cancer, ano po ba daw ang dapat na edad na kailangan magpa-screen ng colon cancer? At kailangan po ba daw dapat magpa-colonoscopy agad? Sorry daw kami, sunod-sunod daw.
Okay, very good question po sa nagtanong. Ang una pong sagot doon is, tama po, importante po ang family history. So pagka po meron po kayong first degree relative, ano po bang ibig sabihin ng first degree relative? Ito po yung mga magulang ninyo, kapatid at mga anak po ninyo. So when do we start po kung meron? So kung ito po ay first degree relative, we determine the age of diagnosis nung inyong index patient. Ibig sabihin, sino po ba yung nagka-colon cancer? Kunwari po ang halimbawa nito ay ang colon cancer ay na-diagnose po at 45 years old, for example po. Meron kayong kapatid na nagkaroon ng colon cancer. Pagka po first degree, you minus 10 years from that first degree. So kung 45 po yung pinakabatang nagkaroon, sa 35 years old and above. So lahat po, magulang nyo syempre, more than 35 na yon. Yung mga anak nyo pong 35 years old and above, at lahat ng kapatid yung 35 years old and above, dapat po magpa-colonoscopy. Ang suggest po ng Philippine Society of Gastroenterology, we prefer colonoscopy over the stool test. Bakit po? Kasi nga po, mas mataas ang risk po ng first degree relatives. Paano naman po kung second degree relative? Kunwari po, pinsan. Pag may dalawa po kayong pinsan na first degree, ibig sabihin ito yung mga pinsang buo ninyo, para na rin po kayong merong first degree relative. Parang kapatid mo na yung nagkaroon ng colon cancer. Ganon din po yung age. 10 years from the youngest na nagkaroon. So kung meron pong 25 years old nagkaroon ng colon cancer, no, dalawang magpinsang buo, minus 10 years, you start at 15 years old. Okay? Hindi naman po ganun kadalas sa bata, pero dumadalas po ngayon ang colon cancer sa mas bata dahil po sa ating kinakain at pamumuhay.
Ayan, no? Ang linaw-linaw po ng sagot ni Dr. Maralit, no? Kung kailan po dapat mag-start yung screening. Meron pong related question po, Doc, no? If with family history, nag-screen na po ng 3 beses at negative po yung 3 beses, when daw po ititigil ang screening?
Okay. Ang screening age po for average risk patients is 50 to 75 years old. So kung kayo po ay may family history, ganun din po up to 75 years old po kayo ni-screen. Ang ginagawa po natin, kunwari po nakatatlong colonoscopy na po kayo, pwede na po nating habaan every 5 to years na po yung ulit ng colonoscopy. In fact, kung maganda po yung pagkaagawa nung huli, kasi po importanteng malinis yung bituka pag sinilip. Pag maganda po yun, even up to 10 years pwede na po. Kasi nakatatlong colonoscopy na normal. But remember the age po, we stop at 75. Kasi ang goal po natin, maka 100 yung pasyente kung kaya nila, di ba?
Okay po, Doc. No? Doc, meron pong mga ibang questions, hindi masyado related, pero may question po. Is it true that acid reflux can affect chest x-ray results? I have a friend who had a medical checkup at St. Luke's Medical Center for his visa, and he was required to have sputum test. And according to some friends, it might be because of his acid reflux. Nako,
Okay.
ibang tanong.
Parang, well, it's not related to our topic, but ano po, ang acid reflux po is a symptom or event. Ito po yung asido ng sikmura bumabalik sa lalamunan. So nangyayari po dyan, pwede kang magkaroon ng triggers para magkaroon kunwari ng asthma because yung pagkain or laman ng sikmura mo bumabalik sa baga. However, X-rays po are not supposed to be affected by GERD unless may iba kang sakit. Kasi po acid po is cleared by our laway. So, base po yung laway natin. So, tinatanggal niya po yung pagka-acido. So, relatively, it's not supposed to destroy our lungs. So, hindi ko po alam na meron pong ganun palang situation.
Mga ibang situation, baka the separate session for that. Meron din pong isang katanungan, is eating grilled meat contributory to colon cancer? Yun, madalas.
Very good question po. Very good question. Unfortunately, yes po. So what do we advise? Ako po, hindi ko po sinasabing bawal kumain ng grilled meat o bawal kumain ng red meat. Ang sinasabi ko po, choose the healthier version of the meat. So ako po, ang sinasabi ko, choose white meat over red meat. What else? Unahin po natin, pinakamarami sana ang isda and seafood over chicken, over the rest. So gusto natin, preferred natin yung white meat over red meat. Ang idea po natin is because processed foods are usually, and itong grilled po, they contain carcinogens po in preparing them. So that's why we try to. Ano po ba yung processed food? Lahat po ng breakfast meals ng Pilipino. Tapa, tocino, longganisa, corned beef, salami, hotdog, sausage. So lahat po nung may silog, Sisilog lang po yata yung healthy doon, pero yung sinangag kasi oily naman. So hindi naman siya nakakakos ng cancer, but of course, cardiac conditions later on. So yun po.
Ayun po, no, lahat ng masarap actually, no? Processed food, canned goods, no? Doc, meron pong comment and I think may questions din. Thank you for the short but comprehensive lecture. As an internist, I always educate patients regarding screening for colon cancer. However, the problem always encountered is the financial aspect. HMOs and insurance don't cover screening. A large percentage of these patients would rather not pay the amount they quote patients for the procedure. What is being done to address these issues?
Okay. So we coordinate po with our government agencies, the Department of Health. In fact po, the Department of Health is very active in promoting colon cancer screening through the test called FIT po. So there are studies being done para po ma-promote namin yung fecal immunochemical test. So I agree po, medyo mahirap kasi medyo magastos. However po, there are government institutions for that can do colonoscopy for free. Basta po may PhilHealth ang mga pasyente ninyo. So I hope you can coordinate with your local hospital, government hospitals po. At kung wala naman pong colonoscopy yung government hospital, you can refer to a tertiary government hospital that has it po. And PhilHealth will cover for that po.
Ayan. So, important po no, na may PhilHealth po ang ating mga kababayan no, at saka viewers if they want to avail of this. Meron pong tanong, Doctor, I just got colostomy at the age of 48. No findings naman po at wala pong family history of colon cancer as of now. Kailan po kaya ang ideal years to make a follow-up? I think this is more of colonoscopy na ano lang po na colostomy. Kailan po yung ideal years to make a follow-up colonoscopy?
Okay. Kung dalawa po yung tinitingnan naming importante, the bowel preparation and the findings. Importante po na malinis yung colonoscopy. Meaning, pagka po pinurga kayo, nalinis po ng gusto yun ng doktor nyo yung colon bago kayo sinilip. So yun po yung tinitingnan. Pag perfect po yung score noon, 9 po yung tinitingnan namin. Ibig sabihin maayos yung pagkaka-prepare. Second po yung findings. Kung normal po pareho, maganda yung pagkaka-prepare at wala pong findings, even up to 10 years po. Pwede pong next yung 10 years from now. Kung wala po kayong first degree relative na colon cancer.
Ayan. Okay po ha. Dapat malinaw po yun sa nagtanong na after 10 years. Meron pong question, pwede po ba daw bilhin sa drugstore yung FIT test? Ayan, para mas maliwanagan po sila saan po yun pinapagawa.
Sa Pilipinas po, hindi po regularly available sa drugstores. But you can have it done in any of those testing centers po. Kunwari po, yung mga private and government hospitals po, they have this FIT available for ano po. And ask your local governments po, sana tulungan tayo na mag-invest on FIT kasi mas accurate po siya than FOBT po.
So, yun po, no, it's a test, hindi po parang hindi po siya yung mga screening test lang po na may pinapatak po, no. Kailangan po talaga sa
Actually po, sa ibang bansa, first world countries, they mail it sa kanilang mga kababayan. So they mail it, gagawin nila, isasubmit nila yung results. So technically po pwede siyang gawin sa bahay. However, in the Philippines po, due to logistics, hindi pa po available sa mga drugstores natin.
Na eventually po, no, Doc?
Sana po.
Yan pong follow-up question po yung nagtanong kanina, is colonoscopy completely covered by PhilHealth or patient still needs to prepare an additional amount?
If it's done in a government hospital po as an indigent po, it's completely covered. Now, if you do it in a private hospital po, hindi po. You have to shell out. Or if you are a paying patient in a government hospital, kasi meron po mga hospital na may private patients din, then you may have to shell out more than PhilHealth po.
We have a question from our media partner, Ms. Annabel Surara. Ano po ang chance of survival ng isang taong may stage 4 colon cancer? Thank you po.
Oh, very good question, Doc, ma'am. No, so kung stage 4 po may A and B no. So yung stage 4A ibig sabihin kumalat na po beyond doon sa colon, kunwari po sa atay. Pag ito po ay stage 4A at natanggal yung kalat, yun po yung maganda sa colon cancer. Kahit kumalat na siya at pwede mong tanggalin yung pinagkalatan. Meron po kaming pasyenteng may kalat sa atay na natatanggal pa sa atay. Tumatagal pa rin po sila ng mga 2 years or more. Yung pong stage 4B, ito po yung advanced colon cancer. So ito po yung end stage. Ibig sabihin, kumalat na po at hindi na matanggal lahat ng pinagkalatan. Ito po, with treatment po, again, more than a year po sila lumalagpas. However po, kailangan po ng malapitang pagbabantay ng ating gastroenterologist at medical oncologist pa.
Ayan po, no. Doc, ang dami-dami pong tanong, no? Meron tayo from Facebook, meron po tayong sa Zoom. So, hopefully, Doc, okay lang po, no?
Sure, fire away!
Is colon cancer work-related? Naku, ibang tanong to. Prolonged sitting for white-collared workers. Ayan.
Awa po ng Diyos, prolonged sitting does not cause colon cancer. However, sedentary lifestyle can contribute po. So ang suggestion ko po sa inyo, pag uwi nyo sa bahay, exercise po, habulin natin. No? So huwag kayong mag-alala, hindi po nakaka-colon cancer ang nakopo. Pero kung nakopo ka lang buong araw at hindi ka na nag-exercise, yun po, it can contribute as a risk factor.
Okay po, Doc. Yun po bang mga mas obese na pasyente po ba, mas at risk po ba sila or hindi naman po?
Opo, obesity is a known risk factors for colorectal cancer. So, highly encouraged po tayo na if you are on the heavier side, magpapayat po. Bawasan niyo po ang ating timbang. Hindi po kami nagmamadali. Hindi po sinasabi namin na kailangan pumayat in 3 months. No. Ang sinasabi po namin, ang pagpapapayat ay desisyon. Decide now and work towards it. Kahit po 1 pound a week lang po, happy na po kami doon. Basta towards consistently losing weight po.
Yes po, no. Tuloy-tuloy na pagpapayat, no, for healthy reasons. Doc, meron pong tanong, is the FIT test still specific up to the stomach to detect malignancy? Ayan.
FIT test po is more concentrated and more specific for colon. It's not really used po for upper GI cancers o yung pong stomach cancers. It's really specific po for mostly colorectal cancer po.
Okay. So, Doc, to detect yung upper GI cancer, meron po bang ibang test na ginagawa?
Yes, we do po endoscopy if we're yung gastroscopy pong tinatawag. If we're highly considering that there is upper stomach or esophageal cancer po. So endoscopy po naman sa taas. Gamit yung camera sa taas, yun po ang ginagamit natin.
Ayun. Para medyo connected din po. Ano daw po pagkakaiba ulit nung sinabi niyo pong flexible sigmoidoscopy at colonoscopy?
Okay. Thank you po for that question. So yung flexible sigmoidoscopy po, ang sinisilip lang po yung kaliwang bahagi ng colon. Ang ating pong colon, ang itsura niya po para siyang malaking question mark. So ang sinisilip lang po yung left side. Yun po ang flexible sigmoidoscopy. Yung colonoscopy po yung buong question mark ng bituka, ng malaking bituka, ibig ko sabihin, ang sinisilip. So mas detalyado po yung nasilip. Kasi kung flexible sigmoidoscopy, sa kaliwa lang po ang sinilip mo. Yung colonoscopy, buong colon na po.
Ayan. So malinaw po, no? Mas marami pong nakikita po pag colonoscopy ang pinagawa po, Dok. Tama po ba?
Opo.
Meron pong follow-up question si Ms. Annabel Surara. Maari po bang malaman ang pinaka-youngest na dinadapuan ng colon cancer? Salamat po.
Okay po. Ang pinakabata, ako po, my personal encounter, I had a colon cancer patient na 19 years old. Napakabata po nito and unfortunately, wala po silang family history. However, hindi po ganun kadalas nangyayari yon. So, it can happen at any age, lalo na po yung meron genetic predisposition. Yung binanggit ko po sa inyo kanina, yung Lynch syndrome and familial adenomatous polyposis. These are genetic conditions po. Ibig sabihin namamana po. Hindi po ito common sa normal or average na Pilipino. So, salamat naman po ito ganun. No?
Okay po, Doc. Isa pa pong tanong, Doc. pwede po ba na sa colon cancer daw walang magbabago dun sa dumi? Hindi po yung constipated o kaya nagtatae. Pwede po ba daw na anemic lang?
Yes po. Isa po sa mga binabantayan namin ay maging anemic ang pasyente. Kaya po yung sinasabi sa inyo, yung pong stool test na yan, yung fit na yan, ay hindi po obvious na may dugo. In fact, di po ba? Kaya po natin ginagawa yun kasi kaya po nilang i-detect yung microscopic na pagdudugo. So anemia po is a presentation that requires colonoscopy given the appropriateness of age po and other indications. Opo.
Opo. So pwede rin po, Doc, no, magpa-complete blood count, no, para
Opo.
makita. No?
Kasi baka mamaya po sakit sa dugo pala yung problema, hindi pala sa colon.
Ayun po. Doc, tulad po ba daw sa breast cancer, ano daw po ang masasabi niyong pinaka-latest o makabagong paggagamot sa colon cancer?
Oh, ang pinakabago pong push namin sa paggagamot ng colon cancer is maiwasan si colon cancer. Remember po, all the treatments available for colon cancer, the advances po ay sa gamot na. But hindi po kasi tayo masyadong nagfo-focus sa gamot. Kasi po hindi siya cost effective. Kung ikaw ang DOH, gusto mo bago magka-colon cancer yung pasyente, hindi na siya magka-colon cancer. Kasi po napakagastos at napakahirap gamutin ng may cancer na pasyente. So ang gusto po natin maiwasan. So most of the developments po, ito pong FIT, this is a relatively better test, a screening test. So ito po yung focus ng ating gobyerno at ng ating mga societies like ng Philippine Society of Gastroenterology na maiwasan yung pagkakaroon ng colon cancer. Yung pong detalye po kasi ng paggagamot, same po yan. Meron po kaming surgery, ang pinaka-important. Second would be after surgery po, chemo and or radiation. So yun po, may mga detalye na po na hindi nyo na po kailangan maintindihan para ipapaliwanag namin kung kayo po yung may sakit.
Opo, no. So, parang importante po talaga, no, ini-emphasize po natin yung screening, Doc, kasi pag maaga pong nalaman, curable pa po siya, no? Tama po ba?
Curable. And even preventable. Imagine nyo po kung nagsimula lang po sa kuntil at inabutan lang natin na kuntil yon. Pag natanggal namin yung kuntil, hindi ka na magkaka-colon cancer. No?
So, importante po talaga. I'm sure marami pa pong mga katanungan. Pero, Doc, meron po ba kayong final message and how could our viewers reach you and other specialists para po magpa-screen? Kasi I'm sure meron na pong gustong magpa-screen after the lecture po, no?
Thank you, Gail. So, una po sa lahat, nagpapasalamat ulit tayo sa tanong na yan. So, una, ang gusto ko lang pong sabihin sa inyo, simple lang po ang hinihingi natin sa ating katawan. Una, piliin po natin na maging healthy. So, gusto po natin, iwasan po ang matataba, mamantika, yung red meat at processed food. No? Hindi ko sinabi pong bawal. Tandaan niyo po, mahirap po ipagbawal ang something na kinagawa ko rin naman. Pangalawa po, di kung kayo po ay nasa mabigat na timbang, mag-try po kayo magbawas ng timbang. Piliin niyo po yung diet na kaya niyo pong sundan at hindi po kayo nagmamadali at feeling nyo hindi kayo pinaparusahan. Kasi pagka po nagkataon, baka bumalik kayo sa dati. Pangatlo po, wag po kayong maninigarilyo. Tumigil kung naninigarilyo. Yung pong umiinom ng alak, ang pinakabago pong pag-aaral at rekomendasyon sa Canada, wala na daw pong ligtas na amount ng alak na pwedeng inumin. Dati po may mga sinasabi pa silang amount, no? Ngayon, yung pinakabago po sa Canada ay wala na raw pong ligtas na amount ng alak. Pang-apat po, magpa-screen tayo. Pag sinabi pong screen, wala pa kayong sintomas, ginagawa na po natin yung stool test para wag po kayong magkaroon ng colon cancer. I would like to encourage you guys to consult your friendly gastroenterologist anywhere in the country. We are about 550 strong po. And we are increasing our numbers po. So come to us and we will help you address your concerns po.
Thank you very much, Dr. Maralit po, no, for your very comprehensive lecture, for answering all the questions. And I'm sure our audience was enlightened po, no, sa importance of colorectal cancer screening. Sa uulitin po, no, Doc, sana ma-invite po namin kayo ulit. So thank you very much.
Thank you, Gail.
Thank you. We would also like to invite everyone to attend the Universal Healthcare Summit on March 25, 2023. This will be a purely virtual event. On May 7 to 10, we have the Philippine College of Physicians will be celebrating its 70th year, and we'll be having our 53rd Annual Congress. This will be a purely face-to-face event at the Philippine International Convention Center, or PICC. And of course, on Saturday, this is on March 11, 2023, from 9 a.m. to 10 a.m., we have our PCP sa Radio Veritas. I am informed. Malusog na tiyan, masiglang katawan, and our speakers will be Professor Diana Payawal and Dr. Ian Homer Kua. So abangan po natin itong mga events from PCP. Okay, and to formally close this session, alam ko po sigurado po tayong maraming natutunan sa lecture ngayong umaga ang ating mga viewers. And I hope everybody will spread the message po, no, sa ibang hindi po nakapakinig. But you may still watch. Maaari pong panoorin po lahat ng mga ng health forum na ito after this po, no. So to close, let us hear a final take-home message from Dr. Ian Homer Kua. He is the second Vice President of the Philippine Society of Gastroenterology, overall Chair of the Philippine Digestive Health Week, the overall Chair of the PSG Mid-Year, Chair of the PSG Committee on Chapters, Councils, and CPGs, and the Head of the Institute of Digestive and Liver Disease at the St. Luke's Medical Center, Global City, and he's also the Chief Section of Hepatology at the Institute of Digestive and Liver Diseases at St. Luke's Medical Center, Quezon City, and the member of Hepatology Interest Group, World Gastroenterology Organization, and the past president of the Hepatology Society of the Philippines, and also the past member of the Philippine Specialty Board of Gastroenterology and Digestive Endoscopy. Let us all welcome Dr. Ian Homer Kua.
So good morning, everyone. First and foremost, I'd like to thank the Philippine College of Physicians, led by our president, Professor Diana Alcantara Payawal, for providing us a platform to promote the Philippine Digestive Health Week and the Colon Cancer Awareness Month. As we come to close of the Philippine College of Physicians Health Forum, we are reminded of the importance of education, awareness, and early detection in promoting digestive health. The insightful discussions and presentations during this forum have highlighted the impact of digestive diseases, particularly colon cancer, on individuals and communities, as well as the importance of prevention and early intervention. I hope that this event has provided valuable information and resources to help you make informed decisions about your digestive health. Remember to prioritize healthy habits such as regular exercise, a balanced diet, and adequate hydration, as well as seeking medical attention when necessary. Let us continue to spread awareness about digestive health and to advocate for greater access to care and resources for those affected by digestive diseases. Thank you to all the speakers, participants, and organizers for making this forum a success. Let us continue to work together towards better digestive health for all Filipinos.
Kua, for that very good closing message. Inaanyalahan po lahat na umattend sa susunod na PCP Health Forum. Every Tuesday po ito. Salamat sa pag-attend sa ating PCP Health Forum. Maaari po itong panoorin ulit ang episode na ito sa ating PCP Facebook page. So abangan po natin ang susunod na PCP Health Forum. Maraming salamat po. Stay healthy and stay safe.
The Philippine College of Physicians, through the Committee on Media Communication and Health Forum, wishes to thank its media partners social media followers, and participants. See you again next time here on the PCP Health Forum. Internists occupy a unique role in healthcare. They are experts in a spectrum of diseases and complex illness, earning the moniker, the doctor's doctor. Internists use their vast knowledge, experience, and skill to identify the best possible treatment strategies, making them scientific puzzle solvers. They are proponents of extensive clinical research, evidence-based medicine, and continuing education, fueled by the commitment to provide high-value patient care that balances science and compassion. In 2023, the Philippine College of Physicians celebrates 70 years of excellence and service above gain. Driven by passion, constancy of purpose, and prudence in internal medicine. Take part in the 53rd Annual Congress of the Philippine College of Physicians on May 7 to 10, 2023 at the Philippine International Convention Center. Together, let's revisit all that we've become and move toward all that we can be. The Philippine College of Physicians is unstoppable in plying the road to 70, taking you closer to its 53rd Annual Congress, month after month. On the third leg of its pre-convention series of activities, the PCP invites you to take part in the Universal Healthcare Summit, Understanding Strategies, Aligning Perspectives, on March 25, 2023. The country's finest internists are called to join forces in driving the importance of universal healthcare by gaining more knowledge and insights on its implications in the practice of internal medicine, real-world experience in the local setting, the internist role as a UHC healthcare provider, financial structures and obligations of various Philippine government groups, and the challenges behind UHC. The road to 70 is just around the corner. Be there for the Universal Healthcare Summit to advance your understanding of strategies and align with current perspectives. See you on March 25, 2023. The Philippine College of Physicians